one. Okay, this is new medicines. Japan is the first country in the world to improve the imiglin. This is approved by DCGI. Okay, they supported by numerous preclinical and clinical studies. This phase 3 trial comes from the there is the imiglin is efficacy and safety, and program managed jointly by the oil and the Symmetrical Pharma. Okay, this is okay. There is oral compounds with a dual mechanism of action that directly improve the increase the insulin secretions. Insulin secretion बढ़ा देगा और improve the insulin resistance. Insulin को resistance तुम्हारे जो insulin resistance होगा वो dual mechanism. इसको dual both two types. Dual means two types. Okay. Next place. Next. Yeah. It's a mechanism action. Mechanism action is little bit difficult, but is the inhibitor of DPP, DPP4. This inhibit the DPP4 is increase the insulin secretions and increase the insulin resistance. This mechanism is NMC and NAD plus, and it is cell is CD38. There's NADPP and NADCPP. The TKC inhibitor and piracy. This is calcium is increase the calcium and decrease come to the calcium. This insulin secretion is increased, and this ATP or ATP is ATP or ADP. This is the receptor. This is ATP plus channels. This is private. This is beta cell. Beta cell की glucose first glucose the blood to next glucokinase. That is inhibited glucokinase. There is glucose 6-phosphate. Then pyruvate. This is chemistry also. This is biochemistry mechanisms. We did this particular not very important. These all things are biochemistry. But biochemistry is so many things only. Next page. This mechanism actions. This mechanism action is this one. This other cellular, it is cellular metabolism. Increase the NAPT and increase the NAD plus. This increase the calcium mobilization. This mitochondria, it effect in mitochondria cell. This cell is there, cell is mitochondria. This mitochondria is partially inhibit the complex 1, reduce the ROS formation, restore the complex T function, and prevent the MTP opening, and increase the ATP generation. That is beta cell. That after come to this enhance the insulin action in liver. So always you need to liver. You have to in the patient come to diabetes. You first have to see the liver. Okay. Liver function test. There is insulin liver reduce excessive glucogenesis done by liver and decrease steatosis. In the muscle क्या होगा तो increase the insulin signaling. Insulin signal देगा signal. That is stimulate the glucose uptake in the muscle. माने मांग में. So next is improve the beta cell function. माने pancreas और beta cell function to improve करिबो. And B cell protection. Beta cell to just to होलो नहीं दिए. That is done by this one. Increase the glucose dependent insulin secretion and prevent the beta cell death. माने beta cell मरने से पहले बचाता है और increase the function of beta cell mass. So that is the immediate function of this. Okay, next please. It a PKPD. Dose is there is 500 also and this 1000 also. 1000 milligram PD twice daily. Very low protein binding 1 to 8%. Urinary secretion of enhanced drugs clearance divided by the creatinine clearance. It is chemistry also. No drug interaction is metformin. A drug interaction नहीं होगा because कुछ लोग medicine देने से drug interaction में side effect हो सकता है. Drug interaction no drugs with metformin, sitagliptin and cimetidine. Cimetidine new molecule also. No QT prolongation. माने harder है तो QT तो harder QT prolongation no. माने harder also safe. No difference between the Caucasian and Japanese subject. This another. This is Mongolian and Japanese. There is protocol is coming. That is Indian, Japanese, European countries different studies there. Next, please. The special population, the Indian regulator, especially we are putting Indian as an Indian doctor. Indian regulator DCCI have advised not using imiglin in any dose in people with type 2 diabetes in CKD. माने chronic kidney disease. माने chronic disease with it EGFR. माने kidney का टेस्ट होता है GFR जो less than 45. हमेशा if the first patient test that EGFR EGFR দেখলো যদি less than EGFR যদি less than 45 হয় আৰু kidney disease এটো মানে মেডিসিন তো cannot give, this medicine cannot give. Secondary stage TB and beyond the stage T4 মানে kidney disease stage 4 or 5 में देना नहीं चाहिए. And this hepatic patients, the patient is suppose pregnancy is not do lactation মানে दूध पिलाने वाला woman को not do lactation, pregnancy, hepatic cirrhosis, is hepatitis BC. Okay, next, the clinical trial experience. There are so many clinical trial experience depends on the protocols, different countries. Okay, next, this phase 2 trial. They have to this trial mechanism of action. This trial mentioned that is the one is group, two groups, that is increase the insulin secretion and improve the insulin action improvement. Insulin improve करेगा. Red is 1, it is 1, is 0.95, 2.5, it is placebo immediate, or it is 1 is placebo. This is a protocol. This is the 18 weeks phase, many is okay. 4 months is the trial করিছে, or number of patients is 59. Okay, next, immediately increase the glucose dependent insulin secretion. पहले बोल दिया मैंने 2 दिया, that is to our insulin तो बढ़ाई दिया and improve the beta cell function in patients type 2 diabetes. The aim is to assess the glucose stimulate the insulin secretion, GSIS the effect of the immigrant, and study all double blind randomized placebo controlled study in 33 patients only. That is also very good, 33 patients. The immigrant treatment is for 7 days, raise the insulin secreted on response to glucose spike. Only 7 days, patient will get result. That is 112%. The according data AUCD 45%. First phase the ICR is 110%. Second phase ICR by 29%. Immigrant improved the beta cell sensitive glucose sensitivity by 36%. That is, and then to decrease the hepatic insulin excretions. That is, our immigrant do not affect the glucose secretions. Glucagon. This another, this glucose and glucagon. Okay. Next please. Efficacy and safety of immigrant in Japanese patients. The Japanese there is called Japan no. And WBL is 24 weeks randomized trial to double blind placebo control. Dose ranging is phase 2 trial. That is SP community is trial this one. That is 12 in the 24 weeks randomized double blind people, double blinded placebo control plus group dose ranging, dose different dose, and phase 2B clinical trial. Patient randomized with 1:1, 1:1 to receive oral dose 500, 1000, and 1500 milligrams, and placebo twice daily, and over 24 weeks period. The primary endpoint was placebo adjust changes in weeks 24 in HbA1c. HbA1c less than come to less than 6. That will get later on. It's very important. HbA1c, the cellular level for 3 months interval. You have to look at this. Okay, next. That is baseline HbA1c is 7 to 10. So less than 6 is very good. Non-diabetics 7 to 10. So that is you can find out whenever hemoglobin given, then automatically go down. Okay, next please. Conclusion is given marginal increase the efficacy of the 1500 versus 1000, 15 milligrams, 15 per patient, and or was 1000 dose, along with potential or glucose gastrointestinal tolerability issues. A dose of 1000 milligrams twice daily was selected in subsequent phase 3 studies. Okay. Next. This immigrant efficacy and safety. In this randomized double-blind placebo-controlled monotherapy trial, 1000 milligram of immigrant was orally administered twice daily, BD, twice daily, plus placebo 24 weeks into 213 Japanese patients. But they do not have mentioned this one before food, along with food, or whatever it is. Okay, next. The time on trial observed to meet the primary endpoint with a satisfactory significant p-value is less than 0.001 SB1C, placebo corrected mean sense of the balance of minus 0.87%, as well as it maintained the secondary endpoint, including the fasting sugar level, plasma glucose level. Okay, very good trial. Next, times 2 trial is immunoglobulin trial times 2. That is all have taken 52 weeks. Open level, parallel group trial evaluate the long time safety and efficacy immunoglobulin was 714 Japanese patients. It is maximum patient is 700. Very good. In this trial, 1000 also given immunoglobulin orally was daily given existing with another medicine with existing with anti-hypertensive agent. You can give also another agent also, basitagliptin, limipide, whatever it is. Immunoglobulin was observed to also the SB1C decrease baseline ranging to minus 0.5 to 9 to minus 9.2. Very good result. Okay. Next, reference themselves sensible baseline and weeks or weeks. That is protocol is given. There you can find out what is online this one. Okay, next page. The amino observed to determine the device efficacy benefit combination of a D2B inhibitor. I already have said DPP4 inhibitors immediately was. But I mentioned all the side effect also. There is another trial is 12 weeks double blinded placebo control. This patient is taking 250 patients, and it is glycemic control very good. In this 36 weeks of open label expense, 208 patients also took them for first 6 weeks study of the treated with insulin as well as insulin therapy. Insulin दिसे और इंसुलिन के साथ इमिग्लिन भी दिसे, इमिग्लिन भी दे दिया, तो उसको ट्रायल के देखा है. There is no any problem. You can give immediately with insulin also. Okay. Next, please. There is mentioned there time course plus SB1C over for 52 weeks study period according to treatment group. There is a red line. This is the gray line. It's very good. Placebo immediately. Okay. Next. The open label extension patients is there. So the sustained manual SB1C decrease from the 0.64% to the received immediately for 52 weeks, and is 0.54% in patients receiving immediately and insulin for the last 36 only. Okay. The SB1C CKD patients, time once 2 TG and immediately. SB1C reduction CKD patients, but it's chronic kidney disease, stage 1, 0.33% times 2, 0.23% to 0.95% times 3, 0.72%, 0.72. Stage 2 में 0.82 और times 2 में 0.02 to 0.95 और इसमें times 3 में 6.64 और stage 3 में only times 1 0.67, other is blanks. Okay, it's very good. Also, so healthy also, but be careful in chronic kidney disease also. Okay, then next. Diabetes immediately in dual daily glucose control provided by diabetes scanner continuing glucose monitoring, respective as single center and observe study. There is already mentioned that there is so many study. There is this also fatigue also. Okay, then next place. Time is very short now. Okay. Next place. And the result is mentioned here. Okay. You can see here also who is online with me. Okay. Okay, next. The carb also mentioned here. Mean glucose level evaluated by ICGM before and after. Before this one, before and after. This carb is mentioned nicely. You can see that. Okay, then next. The MNA clearly shifted daily glucose profile into the appropriate range of Japanese type 2 diabetes patients, Japanese specific goal, including the short-term movement in glycemic control. Okay. Okay, next. Phase 3 clinical trial is report a multicenter randomized double-blinded parallel group placebo control comparative respective phase 3 clinical study to evaluate the safety or tolerability of immediate tablet in patients with type 2 diabetes mellitus individually control with diet exercise. The important, very important diet, sugar-free fat and exercise alone. Okay, next please. There is also mentioned that is at HB1C level less than to end of study. There is nationally mentioned here. There is red line minus 0.86, 0.04. Okay, next please. Okay. Yeah, that's in range of 2 hours EPG and from the baseline to end of the study visit. Okay, it's nicely mentioned here. Okay, this placebo control and this one. I grouping the system organ class, nervous systems, gastro GIT, infection, infectious, muscular muscles, connective tissue disorder, metabolism and nutrition disorder, general disorder or administrative side effect, side conditions. The imeglin is this imeglin hydrochloride tablet 1000 mg. This data is mentioned here. Our placebo tablet is mentioned here. Then lastly, this mainly remember that CNS, GIT, infection, musculoskeletal disease are common connectivity disorder. মানে তোমার আসলে metabolism, nutrition disorder, general disorder and administrative disorder. This data is mentioned here. Okay. Next, please. The conclusion is imeglimin was superior to placebo tablet. There is no date of population of both treatment groups. Imeglimin was found in safe, well tolerated in patients with 2 diabetes. Very safe medicines. Nothing except some kidney disease. We have to look the easy. First of all, you have to see easy effect. If the less than below 45, they do not give you. Otherwise, you can give. Okay, next. Imeglin and metformin, a combination of 2 drugs you are given. Okay, next. Imeglin and metformin you can give. This difference in action. This imeglin is one. The imeglin is single is increase the only imeglin is increase the insulin secretion and evidence insulin sensitivity. Cell organ glucose stimulate the insulin secretion and beta cell production prevents the beta cell mass. Metformin is no reported. Reported is not mentioned by metformin. But no effect glucose stimulation insulin, no non-side effect. People effect of beta cell mass. Okay. So imeglin is much better. Next place. The endocellular level is a very cellular level. The cellular level is compare the both. What is the difference between the both differences? Competitive and partial mitochondrial complex type 1 inhibitor. There is uncompetitive mitochondrial. This is the uncompetitive, is a competitive. This is the competitive uncompetitive. No decrease of mitochondrial response. This imeglin is no decrease in mitochondrial respiration, but in metformin decrease the respirations. And this imeglin is increase the NAD synthesis, potentially the NAMT and increase the glucose response in the cellular. Increase the glucose responsive in the cellular calcium level. But here is no increase in the calcium, no effect on the NAD reported. That is the difference between imeglin and metformin. So you can give imeglin 500 easily than metformin. Okay, next. The effect of CB systems. Okay. Cardiovascular systems. It will be service there. I will mention. Next, please. There is inhibiting mitochondrial permeability. Without inhibiting imeglin prevents the death of the human endothelial cells by inhibiting the mitochondrial permeability without inhibiting mitochondrial response, which may improve cardiovascular risk profile. So it's safe in heart disease also. Safe. Cardiac disease by heart disease. Imeglin is totally safe. Next, please. As soon as Q2 prolongations, and already I said Q2 study imeglin first class oral abdominals. So randomized already control is there. So many control. there is no prolongation of QTC. That is ECG. You can get from ECG. ECG or echo. Okay, next please. There is mentioned there is. You can get also from the ECG report. Okay, next please. QT is the autonomous therapeutic test supersonic response immediately. No reduce the QTC and prolongation. QT and QTC is not prolongation. Already said. Okay, next please. Mode of action, beta sensitivity, insulin secretion, metformin is sensitivity, metformin increase, beta solution tumor increase, and action of metformin. But immediately is insulin sensitivity increase, beta solution increase, 1, 2, 3. Immediately is team, insulin sensitivity, beta solution, action of metformin. Okay, that is your safe. Look at drugs. Immediately safe. All trees. Okay, next. Yeah. Because this emiglin is current available up to emiglin is only oral dual mechanism. The dual mechanism is simultaneously target cell of key organs, diabetes, T pancreas, liver, muscles. Pancreas, beta cell, liver, already said, liver and muscles. The emiglin has been shown to have positive impact of the skeletal muscle glucose. Muscle में glucose होता है, all not even blood. But I telling the junior doctor also. Hepatic, liver, and beta cell process, pancreas. Immediately demonstrate the good efficacy and monotherapy, also combination therapy, maximum benefit. Synergy, RS concomitant and DPT inhibitors. Okay, next please. Thank you. Thank you everyone who was online with me. Order comes there. Okay, I will leave. Okay, thank you everyone. Good night.